Hey there, when you live with a chronic illness, understanding that disorder and being able to manage it yourself is probably one of the most important things. And so that is what we are talking about today in this live video. We are going to talk about self-management and actually the development of a self-management program for people with hypermobile Ehlers-Danlos syndrome or HEDS or hypermobility spectrum disorder or HSD. And I'm diving in with a research review. It's a little Friday happy hour for us. So happy Friday. If we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist. I am the owner and founder of re+active. Wearing my gear today. re+active Therapy and Wellness. We're in the Los Angeles area. And I kind of forgot this was on my arm sleeve though, but like our little tagline is brain-changing therapy and wellness. Something I really care deeply about is chronic illness. And I'm going to be really honest here. That's because I live with one. I live with an autoimmune condition called rheumatoid arthritis, and I've had to manage it for much of my adult life. There are a lot of chronic illnesses that were once thought as rare diseases, and they're not really that rare. Ehlers-Danlos syndrome is one of those. And having a person having the knowledge and training to manage it themselves for their lifespan is so very important. So, I'm always reading literature and loving sharing it with you, loving responding to your questions too. So let me show you this particular article that I grabbed. This is actually from 2022. It's from a group based out of the UK, and it is called Developing a Self-Management Intervention to Manage Hypermobility Spectrum Disorders, HSD, and Hypermobile Ehlers-Danlos Syndrome, or HEDS, an analysis informed by behavior change theory. I loved this article, and I love their approach because it is very person-centered. Basically, and I'll go through kind of what they did and then what they discovered, but essentially it put the person with EDS or HSD in the driver's seat. It asked the questions and informed and used focus groups and feedback to really inform what might be really treatment recommendations for providing self-management. So let me go through what they did and even the background of why they did it, which I think is really important. You know, again, they're coming out of the UK. Now, that's not obviously where I live, but I do understand it as a health system, right? And so they talk about the national health system. I think that's what NHS stands for. To be honest, somebody from the UK can correct me though, but they talk about the health system and how important it is when somebody's living with a chronic illness that those people have the resources, the knowledge, the training, and the support to manage those diseases throughout a lifespan. What happens when people don't have those resources is that they're going to the emergency room, and the emergency room is not well equipped to manage chronic illness. And often, at least from my experience, emergency room physicians aren't really readily familiar with some of these disorders too. And frankly, they're not best managed in an ER. They're best managed in really kind of a holistic, whole person way. So that's kind of what led them down this path to do this study, to really look at, well, if we're going to help people manage a chronic illness that they're going to live with for their lifetime, what is the best way to do that? And what I love is that they went to the people and asked them. This is how all of healthcare should be. And frankly, I love this type of research. It's not easy to do. It's not a randomized controlled trial. But it's starting with the person. I just love that so much. That's how I value clinical care, right? So they started with people. So I want to go, I've got the paper here in front of me. I wanted to kind of go step by step with what they did, because I think qualitative research sometimes to me can just be like a little harder to understand. And oh, hi Sue. Sue says yes, 100%. Allison, also hi Allie, also said truth. I think this when we talk about self-management and we talk about chronic illness, these folks can really resonate with putting the person first, listening to them, and having the tools, knowledge, strategies to be able to manage for a lifetime. So when it comes to a genetic disorder like hypermobile EDS or a hypermobility spectrum disorder, these are not something that you that there's a cure for or that you recover from. These are things that you live with and you manage. And one of the things that I liked about this article very, very much, and this is like my inner OT. So I'm not an occupational therapist, but I love occupational therapy. I am a physical therapist. But they rooted their qualitative study here and their even their interviews and the way they kind of modeled and put this into a framework based on behavioral change. And they used a model, gosh, I wrote it down here. They used a model. It's TDF. Okay, so they mapped this information based on two models, TDF, Theoretical Domains Framework, where they took multiple frameworks of behavior change and put them into these kind of 14 categories. And then they used, and this was something I hadn't heard of, the COMB, another framework of capability, opportunity, and motivation. So they took barriers that people found to self-managing their disorder and mapped these two categories, because it's very helpful not to just be kind of like free for all, right? Like everything you could ever want to know or all of the particular pieces of this disorder, but let's map it to these key frameworks of behavior change, because when it comes to managing a chronic illness, those are the pieces, right? It's not just knowing what to do, but actually how do you do that on a day-to-day basis for the rest of your life? It's about habits and making shifts and changes, right? So it's not a one-time here, take this medication, get this surgery, right? It is sustaining a lifestyle, right? And this is where OT comes in. So again, I'm not an OT, but I love working with our OTs. And this is really what they do, is not just like one and done, here's like a treatment technique and you're going to be better. It's more like, let's figure out how to make this sustainable. In chronic illness, sustainability of behaviors, of lifestyle, like this is the key. This is why every single person with a chronic illness really should have an OT. Okay, that's just the start of my soapbox on OT. I love occupational therapy. And I think most people don't realize that this lifestyle and sustainability of lifestyle for chronic illnesses is what OTs do. This is what they do. They're so good at it. So that was the first step. They took these frameworks. Then they did a systematic review looking at the literature in both hypermobile EDS and hypermobility spectrum disorders. Then they did an interview with 17 people. This included a patient researcher, other researchers, and clinicians in the field to look at the current research and recommendations for management in these disorders. They mapped this information to these behavior change frameworks. So I think this is really important that it was rooted in something that has, again, just like a really firm background of behavioral change. So that's just the first step. The second step then is that they did focus groups with people. Again, key researchers, patient researcher as well, to review some of the barriers and suggested interventions and treatments for those. Then the third part, they brought in a patient focus group, and this was a 9 people. That was kind of a convenience sample of folks that they brought in. And yes, there's limitations to this, right? It wasn't 9 people's not representative of the entire world. They happen to be 9 white females. So that certainly doesn't represent the people that I see with EDS. So just keeping that in mind, every research study has its limitations. That would be one. So they did a focus group with these, got feedback. The patients gave their suggestions for treatments. They voted on and they ranked their top treatments. And then we got this lovely table. So these are the results. Let me share this. Now, I have a feeling they're going to be super tiny. You can't read them. They even already have my highlights in them. I can't wait to share these with you, because one of the things that I love, and this is a beautiful thing with this qualitative research, is that you see direct patient quotes. And these patient quotes really resonated with me and what I hear from clients that we see, just even my own experience. So you can see on the left-hand side that TDF domain. So there's education, training, environmental restructuring, and then modeling. These were the top 4 categories that really came out, or domains, I should say. These were the top 4 that came out in this study. Then they had what people, and again, these were people with EDS and HSD who said, these are the things that we need. We need education. We need education and knowledge about management of this disorder. We need to know about pain control. We need to know, are my fears real about decline? What I loved is, they talked about patient-specific experiences in here, and said that patients expressed, if maybe they were in a Facebook group or they were online, maybe they saw and heard stories of people having really severe declines, and that this was a degenerative disease. And we see this, by the way, not only in these disorders, but others, where that then, of course, you would fear that occurring. And is that rooted in reality? Is that one person's experience? What is the actual experience and physiology happening with the disease? Is it degenerative or not, right? These are the questions that people are going to ask. And what they were craving is understanding and knowledge to know, like, is that just one person's experience, or is that going to happen to everybody? And just as a side note, we were talking about this last night in Brain Bites, because this comes up in Parkinson's, which is a degenerative disease. And sometimes the vision that people have is maybe they actually saw somebody with a Parkinson plus syndrome and not Parkinson's. And so their image and fears of what was going to occur were greatly outside of what the norm was. And this occurs in these disorders as well. So education about that, education about coping with injury and pain, education regarding exertion and how to pace. Lots of requests for education around pregnancy. This comes up a lot because this is a disorder in young women. Oh my gosh, I love this one. Wanting to have education around what's a trusted resource, right? Like, and here I am on social media talking about this, talking from a research article, but you want to know, is this even like a trusted journal? Is it peer reviewed? Is this just TikTok? Or is this Instagram just sharing, off the cuff recommendations, or is it really research and evidence based, right? So they wanted education on that. I think that's really, really important. It's hard to sort through information and really know what is real and what's not, to be honest. It's really, really hard. So I love that. And then I love this quote. So I actually highlighted it up at the top. It says, I haven't necessarily found a huge amount of help from medical professionals. I've certainly found that the most of the knowledge I've gained has been from fellow hypermobile sufferers, or EDS, people who had those diagnoses. I tend to look more towards those sorts of people as the people who are knowledgeable. Amen. So do I. So I love this quote because it also is sharing what people need is not just a medical provider to spout information. They need to talk to people like them. They need a community that's safe to do so, right? Another quote down here. So two other areas that people wanted: training, environmental restructuring, and modeling. So training, what people are looking for are skills for advocacy and assertiveness and communication to let people know their needs. I hear this all of the time in our memberships, that people want the knowledge and training to do this with their family members, with healthcare professionals, with their friends, so that people can really understand what they are going through. Other areas that they wanted training were in pacing. Oh, I love this. Basically, folks want occupational therapy because that is what they focus on. But our psychology team does this as well. But they wanted training on pacing. The second to last section here: environmental restructuring and enablement. Folks again voted on these categories. They really wanted to understand how might they alter the physical environment and get OT help so that they can do things independently. And here's a quote: occupational therapy is just one of those small things that made such a big difference. Small adjustments that you can make to your life that can have such a positive impact. There was discussion in the paper how people shared that they wanted to do things independently, but their physical condition didn't allow that. And maybe the tasks were too challenging for them. And so can they get the help to restructure their environment, restructure their tasks so that they can do it independently? Absolutely. And OT is just phenomenal for this. So I love that came up in here. Also, from an enablement standpoint, people wanted access to emotional support, mindfulness, counseling, CBT, and even books that were specific for them. And I loved that as well, because I think when you're living with a chronic illness, it really pays to have that emotional support. And then last was modeling. And I loved this suggestion as well. So they wanted first person narratives, other people living with the diseases, how they manage depression, how they manage frustration, how they managed feelings of loss, pregnancy, and how they coped. They wanted positive examples of this. What people shared was that online or in groups, they unfortunately saw a lot of negative imaging of this and not a lot of positive imaging that they could model. And so this was something that was a need in the self-management of these disorders. And this was another quote at the bottom here. It says, when you're talking to somebody who's been through it, their knowledge and experience sometimes seems a bit more valid than someone who's read a lot of stuff in textbooks. I just want to say amen to that. I 100% agree. And I'm a person that reads a lot of papers and a lot of textbooks, but there is nothing like listening to a person who has a disorder. And the amount of learning that I have from the people that I am in contact with, the people I see as patients, it's just way above any knowledge or training that I've gotten from a course or books or papers. Hands down. Someone else is sharing too about this modeling piece. I agree. Their groups can be very disheartening and negative. I tend to stay away from them. I hear this from people all of the time, yet we know and we hear from this study that this is what people need. They need the positive modeling. They need to hear from other people, and they're hard to find. This has not just this paper confirmed a lot of what I hear, a lot of what I know and understand, a lot of what OT does in helping our clients manage chronic diseases, and really confirms a lot of what we do. I'll stop sharing this little table here. What we do at re+active in terms of building communities of support. So this is something that we've been thinking a lot for the zebra population. Stay tuned. This is something we would really like to do, is basically put this paper into action for people. But we've done this when re+active started. One of the first things that we did was to create groups for people. We started in Parkinson's. We have a Parkinson's membership now. We did it in functional neurologic disorders. So we have a whole membership. And part of that membership group is actually positive modeling. Now, not toxic positivity. It doesn't mean you can't talk about the bad stuff, but the positive modeling of behaviors was so important. I want to say hello to Alyssa, who is sharing re+active. Is the first time I felt positivity about the situation. Thank you for sharing that, Alyssa. And when you have a chronic illness, and many people have chronic illnesses in the world, sometimes, and again, I'm just going to speak from my personal experience. When I was first diagnosed, the doctor actually painted this terrible picture. I was going to be in a wheelchair, joint contractures. I maybe shouldn't have kids. If I had kids, I shouldn't breastfeed them. I was going to be on medication the rest of my life. The medications had terrible side effects. This was just from the doctors, right? And so I had no positivity. Zero when I first got diagnosed. I also worked in a hospital where I worked with folks with the disorder that I had who were severely disabled because of it. That was my only picture. That's all I had. I was not surrounded at all by anybody who had been really living well with the disorder, who managed it well. And quite frankly, I declined quite a bit with that picture in my head, and not being empowered to do something for myself and for my health. And so very thankful. I got another doctor. I had a wonderful experience with a physical therapist, and my life has completely changed, right? And I have really great positive models of folks living with me, for me, living with chronic disease around me all the time. And the sky's the limit for what I can do, right? Like that doctor told me maybe not have kids. I have 2 amazing teenagers now. Did I breastfeed them? Absolutely, yes. Am I actually off medication now? Yes, I am. He told me I should never run again, and I'm running marathons. And I'm not to say this is everybody's experience, but because I shifted myself to have some of these things that they suggested for this group of folks with chronic illness, I've seen just a world of difference for myself. And so while I don't have every chronic illness that has ever occurred or that I talk about on here, I certainly have the experience of meeting with many clients with chronic illness, and knowing and understanding some of those things that people are seeking and identifying that they need are so important. Lots of education, lots of training around what they need, modeling with other people. So I share this because one, this article, by the way, free full text, I'm going to put it in our newsletter for next week. And if you are a clinician, this basically gives you an outline. These are things that people with hypermobile EDS or HSD are asking for in a self-management program. You could start using these right away. Like right away. And you could design a self-management program for people, specifically with some of these things. I think it has some wonderful, ideas for you. And I think if you are a person living with a chronic illness like EDS or HSD, this also, I think, really validates one, you're not alone. You might read these quotes and think the exact same thing. I know in reading these quotes, I've felt some of those things, but I've heard those things many, many times. And it also will say, hey, you can advocate for these things for yourself. You can successfully manage hypermobile EDS and hypermobility spectrum disorders. You can manage those with the right tools and strategies. It doesn't mean you have to go to therapy for the rest of your life. It doesn't mean you need kind of weekly therapy. Now, some people might need that for a bit to get started and get some of these tools, but with the right tools, you can manage. Now, that study was not this study, right? So in this study, they were really kind of developing those recommendations and characteristics for self-management. But the next study would be to implement those and actually see how people do. Now, I will tell you, because we run an integrated program, we are an EDS Center of Excellence at Reactive. We run an integrated program with PT, OT, psychology, yoga therapy, fitness programs for people with EDS. Like, absolutely, these self-management principles are a huge part of that, because we don't want people to just get better. In fact, the authors, let me quote this, the authors talk about a really lovely study out of France. Let me see if I can find it in here, where they did a 6-week program for people with EDS. People did really well. And then they didn't maintain it. And it sounded like a wonderful program, but you can do a really wonderful program and you can get a lot better. But if there's no part of that program that is based on you being able to manage your symptoms yourself, manage a disease yourself, then what are you taking for the rest of your life when you live with this disorder, right? Self-management is so, so very important. And Chrysalis Kid says, that's amazing. Anecdotes like this are very encouraging. This is why we share stories at Reactive of other people living with chronic diseases, managing things on their own, having strategies to make it through their life, to try new things. We believe very firmly from our own program that treatment is really important, but treatment is nothing if you can't take it into life. If you can't have strategies that you would use on a day-to-day and be able to manage things for the rest of your life. That is not just with EDS and HSD, but with pretty much everything that's a chronic illness. You need strategies, not just a short-term fix it, which sometimes, well, and to be honest, I've felt this way too. I would very much like a short-term fix it for things. And some things can be helpful short-term, right? But in the long term, what you really need is those like knowledge, tools, modeling, all of the things that this article shared. So again, I'm just going to share the name of the article so you could grab it. I'll put a link in our newsletter for next week. If you're not on our newsletter, you can simply comment newsletter on our post and we'll send you the link. We have a newsletter specific for clinicians. Clinicians, you should get this paper. You should absolutely get this paper. If you work at all with people with EDS, hypermobility of any kind, I highly recommend this paper. This paper gives you a bird's eye view into what people need and what people want. So clinicians, if you're not on our newsletter, you can go to reactiveeducation.com or just comment newsletter and we'll send you the link. And then if you're a patient, if you're a person with a chronic illness, if you have EDS, you can also comment newsletter. I'll send you a link for our patient-specific newsletter for you. And I highly recommend this paper. Now, Chrysalis Kids says, I'm in regional Western Australia. Oh my gosh, thank you for joining us. I love connecting with people like all over the world. Very limited options available here for support and help to even start to self-manage, in my case, FND. Well, I will tell you, Chrysalis Kid, you should join our FND membership because it's all about self-management, education, community. You get to join our very positive community of people with FND. Send me a direct message. By the way, I can send you the information to sign up. But I absolutely love our FND membership for that reason. Now, I want to share one other thing here because we actually created a little self-management toolkit for people with EDS or POTS, hypermobile folks. This would be helpful for you. But this was our OTs designed this guide, Compression Wear 101, and it is jam-packed with information and links and resources for you to save you a bunch of time if you are looking to add compression, which can be very, very helpful for hypermobility, for EDS, and for POTS. So you can download this guide. By the way, it's on our Zebra program website, so reactivept.com/zebra. But also, and on any of our posts and things, you can comment compression and get the download. But I love this guide, and I've had several clinicians, by the way, download this guide and give it to their patients when they're getting started with compression. So this is one way that you might be self-managing a disease is with the right equipment. So, and this was made for people to start that process of self-management. So go grab that guide and then be on the lookout because we've been kind of obsessed with all of these topics. But next week, we'll actually be announcing we're going to have a brand new workshop that's led by myself and our OT, Naoya Ogura, who leads our Zebra program, who helped our clinic become an EDS center of excellence. We're going to be talking about the sensory system. So, so very important in self-management of these Zebra conditions. So, stay tuned. That workshop's coming up in February, but we're going to announce it next week. But I'm just kind of giving you a little sneak preview of that to come. So anyway, as usual, I just want to say thank you. Thank you so very much for your curiosity about these things, for really asking great questions, clinicians for really caring to listen to your patients and to keep learning and growing and doing better. I'm so thankful for you. And I do want to say too, I'm really thankful for this community who has joined online. We have had many people around us impacted by the fires. We are in Los Angeles. One of our clinics is very close to that Palisades fire. And we've had patients who've lost homes. I've had a lot of colleagues who've lost homes because the Eaton Fire was actually where a lot of folks who work at USC lived and owned homes. So I've shared links, and I know folks have supported people with GoFundMe's. We have been running all of our online classes all week, and we're going to do it all month. But we are donating all the proceeds from our online wellness classes to people affected by the fires. Our psychology team is providing free psychology services to people affected by the fires. We've had at least 2 people take us up on those. We've been even able to provide other services for free. So I am just so thankful for you in our community who's reached out to just check in and see how we're doing, but have supported a lot of these causes. So I really just want to say thank you for that. It really means a lot. And we have such a really just great community, and I'm so thankful. So it does, this week has been much better than the last in Los Angeles, and I'm so thankful for that. And we're gonna just be continuing to support and help our fellow community members here in LA. So thanks again for joining this. I'll post the recording up here soon, and you can grab it all on our newsletter. Thanks so much, and I'll see you next time.